C3N stands for Collaborative Chronic Care Network, and essentially what we're trying to do is harness the inherent motivation and collective intelligence of everybody working and living in the healthcare system. We know that patients get about half the care that they need and do about half of what it takes to stay healthy, but it's not because nobody has good ideas. Everybody has good ideas, and it's not because nobody cares. Everybody cares. What we don't have is a system for harnessing the collective intelligence and the inherent motivation of everybody to improve health and healthcare. So we're borrowing a page from Google and Wikipedia, trying to make it possible for everybody to be part of the solution, trying to make it possible for everybody, patients, doctors, clinicians, researchers, other people to collaborate together on a shared platform to be able to aggregate their information and come up with solutions to problems that are important to them.
And how exactly does it work? How does a patient contribute to this aggregation of knowledge?
The first step is to be aware of the fact that this exists. So we're working with Improved Care Now, which is a network of pediatric gastroenterologists. A lot of patients don't know that their site is part of Improved Care Now, for example. So we're trying to put an awareness campaign together to make sure people know, and they can sign up for more information. But that's the first level. Then you can participate by using the tools that are available. So we've built tools to make it easier to track your health. We built tools that make it easier to share what you've learned as a patient. We've made tools that make it easier to connect with other patients. So participating means doing that, using the tools. And then some people go beyond that to contribute to the betterment of the system by improving the tools. We have parents who have who not only read the blog but blog themselves. Patients who blog, patients who help us on our design teams. They're part of the innovation teams, and they're on the research teams with us. And then you have people who are like owning this system, right? And they're right out in front. They're creating new tools. They're raising money. They're coming up with new ways of doing things. We have a parent who, on his own volition, started a website to raise funds for this. People can contribute in all kinds of ways.
Really, you're building a whole community with all of the different players involved, not just the patients and the doctors, but also the patients' parents,
right.
And allowing everyone to have input into this space. So that's fantastic.
Yeah.
Are you starting with certain diseases, and then expanding outwards from that?
And we are helping Improved Care Now, which is a network of pediatric gastroenterologists, transform into a collaborative chronic care network, or a C3N. And we imagine that what we learn with Improved Care Now, we will be able to actually apply to other conditions. So we're talking with people from the cystic fibrosis community, type 1 diabetes, multiple myeloma, juvenile arthritis, a variety of different conditions, because we want to take what we've learned and not reinvent the wheel. We think there's a lot of lessons that can be generalized.
And what has patient response been to this new network?
When people first find out about it, they're very excited. And then they say, well, how can I get involved? So they have to find their own level of involvement, whether it's just being aware and keeping up to date, or actually participating or contributing. But most of the people that we talk to and people who are involved are very excited about it. If they don't have IBD, if they're not in that community, their first question is, well, can I get one? So we're working as hard as we can. There are some extensible technologies. There are some things that you can replicate quickly, but in a lot of ways, it's not about the technology itself. In a lot of ways, it's a social and cultural process. I'm feeling like more and more this awareness of this idea is out there, and so become hopefully easier to do that social and cultural change.
I imagine you can eventually apply what you've learned here to all the other hospitals throughout the country as well.
Ideally, yes.
Yeah.
Right. I mean, we have to kind of rethink what it is that we mean by health. and what we mean by healthcare. A lot of people imagine healthcare to be something transactional that I as a doctor can give to you, but it's not. You know, doctors go to medical school because they want to make people better. It's a team sport. It's shared work. You have to think about health differently. You have to think about what it means to be a patient differently, what it means to be a doctor differently, and this is the conversations that we're having here at Medicine X, you know, and ideally, you know, disseminate that to a lot of places.